Welcome to the final Global Health Landscape Symposium concurrent session for this morning. I am really happy to be here to introduce our GHC Health Equity Working Group. Before I start sharing my screen, I do just want to highlight two of our presenters and also talk about what we're going to be presenting today. So I'll start with introducing myself. My name is Eliana Monteforte, and I'm the Director for International Advocacy and Engagement at Global Health Council. I'm here to moderate this session on our newest GHC working group that's focused on health equity. This working group was launched this year about 8 months ago now, I believe, and it's our only working group at Global Health Council that is strictly for civil society organizations based in low and middle income countries. Prior to launching this working group, GHC conducted various surveys. We had a lot of in-person as well as online virtual consultations, as well as focus groups with various CSOs around the world to determine how Global Health Council could help support civil society organizations and their advocacy at the regional and country level. Based on all the feedback that we received, we assembled the working group that we have today. And I'm very proud to work side by side with our two co-chairs. Amal Arifej, the Director General of the Royal Health Awareness Society, Arhas in Jordan, and Rabia Saad, who's the Executive Director of Action Girls Foundation in Tanzania. So before I hand it over to Rabia, who will get us started today, I'm just going to go over a few logistics. So this session is being recorded and it will be posted on the event platform shortly after this session ends. We will be sharing the recording externally soon after the close of the Global Health Landscape Symposium. So you are more than welcome to disseminate the recording far and wide once it hits your inbox. We would love to get more civil society organizations engaged into this working group, and we welcome new members. You are also welcome to ask questions at any point in the chat box during the presentations. This presentation is going to be about the working group, some of the achievements and challenges that we've had, as well as what we're planning for 2025. We really welcome any questions you might have about what we're doing, but also suggestions. If you have any suggestions for things we can be doing next year, people we should be meeting with, technical areas we should be focusing on. This is a great place for us to talk about those things. You're also welcome to wait until the end of the session for the Q&A part of this presentation where you can raise your hand and you're welcome to ask the question directly to our audience members. So please feel free to ask questions at any point. So without further ado, I am going to put up the slides in a minute, but I'm going to go to Rabia first. And Rabia, you're more than welcome to first introduce yourself, talk about a little bit about your organization so people get a sense for the kinds of organizations that are part of this working group. And once we learn a little bit about you and your organization, it would be great to hear about the purpose and objectives of this working group. Also, any key achievements and challenges from this year that we've seen, would love to hear all about that. So let me just put my PowerPoint slides up for you, and then I'll let you get started.
Yeah.
Okay. Over to you.
Thank you, Eliana, and good morning, good afternoon, and good evening, all of you from all over the world. Yeah, my name is Rabia Saad, as Eliana just introduced me, and I'm the founding executive director of the organization in Tanzania. It's called Action Girls Foundation, which is mainly focused on raising awareness to youth and especially adolescent girls on sexual and reproductive health and rights. And also, I'm delighted to serve as the co-chair of the Global Health Equity Working Group, together with Amal. And I can say that we are so happy to be here today and joining all of you. And also, Eliana, thank you so much for your leadership, being together, working alongside other organizations that are also part of this working group, which is comprised of different organizations from the low and middle income countries. And yeah, I can start already with the presentation for today. Yeah, so the Health Equity Working Group is just a group of advocates from civil society organizations, which are based in low and middle income countries, as I've just said. And we have come together as organizations just to share information and coordinate collectively to advocate around key health equity issues. And for 1 year now, because we started this January, and for this time only, we have been able to work together to co-create an advocacy strategy that can be used at the national, regional, and global level. And so far up to now, we have already been engaged as a working group to both regional and global levels, and at the national level, of course, as organizations, we're working to champion also these kind of strategies that are actually collectively to work together. And also another purpose, we are working to ensure the health equity is being addressed in health policies, plans, and initiatives at all levels, as I've mentioned before. And together also, we have been sharing knowledge and information on key health equity issues that have been raising or have been emerging around the world. And also we get to hear from other stakeholders on key health equity issues that are happening, and we are acting upon them as well. And also we are kind of networking with other advocates and partners in the health equity spaces. Like for instance, we have been attending as a working group the such spaces or health spaces like the World Health Assembly, the 77th World Health Assembly in Geneva this year. But we have been attending also the NCD meeting and high-level meetings. I know my co-chair Amal also attended this during the UN high-level meeting in New York, and I think she can be able to talk about that a bit later. So that are the kind of purpose and goals for our working group that we have been sharing. Next slide, please. Yeah, so these are the kind of achievements that we have been able to get so far from now. So together, as part of achievement of the Global Health Equity Working Group, we have been able to assemble as a group of just low and middle income countries advocates. And so far, as I've mentioned before, it's a kind of group of organizations that are working on different areas. Like for my organization, we're working on sexual and reproductive health, and other are working on mental health advocacy, and others are working on NCDs. So it's kind of comprised of different organizations which are doing different work around health equity in their countries. But also we have been able to develop an advocacy plan, and this advocacy plan has like the key message that we have developed together, and that we are also advocating around the spaces that we have been able to attend. Like I mentioned, we got the opportunity. So personally, I attended the 77th World Health Assembly as part of the delegates from the Global Health Council, and was able to read the statements from that were presented to the member states on urging, the member states to act on the international negotiating body for pandemic preparedness, and to make sure that they agree to pass this pandemic accord by the end of this year. So these are the kind of advocacy activities that we have been engaged in. They are actually in our advocacy plan, and we have like issues around advocating for also people living with disabilities and NCDs. So we are basically touching all groups. And as I've mentioned, also we have people with mental health equities, mental health, and that is also an issue around health equity. So we have been also working to advocate for that. And maybe just to add more, we have also advocating for like health workers, how they are supposed also to be engaged and protected during like the health crisis, and around also issues like payment for them. But also we have been able to develop top health equity priorities that we are working on through the advocacy plan as well. But as well, we have been able to provide inputs to global key initiatives such as the WHO Global Program of Work and the 77th World Health Assembly through the activities that I've just mentioned, that you have been able to read those statements and also participate as part of that. And so far for this year, we have been encountering, like I can say, some challenges which we have been encountering as a working group, and that is mostly about expanding our working group. So we started as collectively 40 organizations from the low and middle income countries, but it's been like only 10 organizations that have been active in attending the meetings. But we are trying now to see and come up with strategies on how to engage more and expanding our working group so as to have like a number of organizations that are active and participating to, the monthly meetings and all other key advocate messages that we are planning to do. And also through this, we have been able to do like a 6-month feedback via the survey. And we have been discussing also in monthly meetings. And from this, it's good that we got opinions from the members from this survey. that our members, organization members of the Health Equity Working Group, still wants to network more with other CSO organizations, but also connect with other global health and country leaders, and also more of building their skills and workshopping opportunities that will be available, through the network of the Global Health Council, and also among organizations from the working group and other working groups as well. But also we want to gain more visibility on the regional and global stage. And one example from this is that we have also been able to develop a blog and come up with an part of our advocacy plan that was basically talking about the health equity in conflict settings. And we have tried to speak on what's happening currently in Sudan, in Gaza, and also in Ukraine. So this is like the kind of how we want to engage more on this global and regional stage through our advocacy efforts. Yeah, so thank you so much. I think, yeah, that was what I wanted to present to you, and over to you, Eliana.
Thank you so much, Rabia, for giving us an overview of what we're about and what we've done so far, and some of the challenges that we're working to overcome. I'm now going to hand it to Amal. Amal, could you walk us through the key elements of the health equity advocacy plan? Also, talk about some of the activities the working group is planning on doing next year.
Yes, sure. Thank you, Eliana. And again, I want to echo Rabia's being grateful and thankful for all the work and the leadership that you are doing, or bringing into the group, and to thank the Global Health Council for this opportunity, because really low middle income countries feel like they're not a good participant in the global health scene. So within this group, we are given the opportunity to voice and to participate actively into shaping the global health scene. As Eliana mentioned, during the past few months, during our presence within this group, we were discussing multiple issues, mainly the advocacy plan that we want to put together, and then the key advocacy messages. And the first exercise we wanted to tap into was to identify our audience. Who are we advocating to or with? So we identified four audience groups: the governments, the multilateral organizations, regional bodies and associations, and definitely the civil society, community, and other advocates. And then we dived a little deeper into our advocacy plan, and we started with identifying the issues that we wanted to tackle within our advocacy messages. So we identified a couple of issues, like the lack of health equity data, the need to ensure that there is a health equity lens in all health policies, plans, and initiatives. Also, there's the issue of needing to address stigma and discrimination among vulnerable populations. We also discussed the need for more community and civil society engagement, particularly from affected populations, and the lack of access to health information, tools, technologies, as well as understanding the benefits and risks of digital health and artificial intelligence. And last but not least, the lack of gender equity, especially women in more leadership roles. So these were the main issues that we were able as a group to identify. And we definitely, as Ilyana mentioned, welcome all your ideas, inputs into how we can enhance this plan. What areas did we miss adding? And this will definitely help our enhancing the messages or the advocacy messages that we are trying to develop. So after identifying the issues, we also identified some of the activities that we would like to address these issues with, such as developing and disseminating the advocacy messages, hearing from people living with the different health issues, as well as one-to-one meetings, especially with governmental entities. The next exercise was to take a stab at developing our advocacy messages. And here we identified, I think the slide before that, yes, thank you, Ilyana. So we identified 7 areas or 7 action areas. The first is to ensure equity and transparency in healthcare financing. And the key priority actions that we discussed within the group were equitable budget allocations based on population health needs, particularly those who are left behind, foster public and private partnerships to increase healthcare investment, provide insurance packages that are inclusive, non-discriminatory, focused on prevention, treatment, rehabilitation, etc. So these are the main priority actions. Again, we welcome your ideas in enhancing them. The second action area was the strengthening of the primary health care to increase access to basic health services. And here, the main priority actions that we identified as a group was to develop an essential health packages that are free of cost and based on population needs, particularly groups most left behind. Also, to strengthen the prevention and early diagnosis and treatment and lifelong care. We also discussed the focus and the importance of focusing on primary health care to increase health literacy, particularly among marginalized and vulnerable populations. We also talked about the need for promoting healthy aging activities such as good nutrition, daily physical exercise, regular medical checkups, and so on. Finally, we talked about also the financial support, equitably compensating equitably to compensate and train healthcare workers, including the community health workers, to increase the coverage and the access to primary health care. The third action area that we discussed was to improve the quality of health services for the most vulnerable and marginalized populations, such as the LGBTQIA, refugees, migrants, people with lived disability, people with other diseases, and older people, women, girls, etc. And here, we also had a set of priority actions, such as addressing stigma and discrimination in health service provision, designing healthcare systems based on population's social determinants, improving healthcare workers' capacity and compensation, as well as training to provide culturally sensitive and age-friendly services. We also discussed the importance of investing in proper healthcare infrastructure, medicines, and technologies. The fourth action area was to improve health equity data for decision making. And the priority actions that we discussed were routine gathering and analysis of health data to inform health policy development, which is essential. And we saw that and the importance of that, especially during COVID. We also talked about the development of accountability frameworks to monitor population health, particularly of those groups most left behind, and strengthen the data governance to ensure safe collection and gathering of data, maintaining confidentiality and upholding patients' data rights. The fifth action area was to have a greater and more meaningful engagement of civil society communities in developing, reforming, implementing, monitoring, and evaluation of healthcare policies and programs. And here we also discussed the need to increase multi-sectoral collaboration among governments, people, providers, social services through sustainable and fully funded social participation platforms. We also talked about building capacities of communities and civil societies so that they are able to engage meaningfully in the health policy development and implementation of monitoring and evaluation. And also we talked about intentionally including and financially supporting communities and civil society participation. The other action area was to address gender inequalities in policy reform, planning, implementation, and monitoring and evaluation. And here we discussed the support and fund additional research on gender roles and their impact on population. We also talked about the need for providing protective gear that properly fit women in healthcare and to increase the representation of women in health leadership and governing roles. The last action area that we discussed as a group was to develop equitable emergency response teams and plans to address health in crisis situations, such as conflicts, natural disasters, epidemics, and pandemics. And this was heavily discussed because of the current situations around the world, as Rabia mentioned. And we talked about some certain priority areas, such as ensuring emergency response teams achieve gender and age parity and include communities and civil society, particularly those with lived experience, to ensure that the programs reach and meet the needs of those most affected. Also to protect health and care workers and crisis response teams at all costs. And finally, to ensure the safe passage and distribution of humanitarian aid, including medicines and other essential supplies. So these were the main advocacy messages that we discussed as a group. And again, I want to highly emphasize the need for your participation in enhancing them, because I'm sure that we missed a couple here and there. Finally, I would just add or end by saying some examples of what are the activities that we are planning for 2025. So we intend to have a publication on health equity topics, such as health equity in conflict settings, as Rabia earlier mentioned. We want to host webinars to discuss the publication as well as other health equity topics. We also want to start documenting and sharing stories and success stories from individuals with affected community within the affected communities. We also thought of providing inputs, developing statements for key global health events and moments. And finally, we are thinking of holding town hall sessions with country or regional or global health leaders to discuss all these advocacy messages and start the actual activity or advocacy implementation. Thank you very much. And back to you, Eliana.
Wonderful, Amal and Rabia. Thank you so much for the quick overview. Before we go into the Q&A or the discussion, I just wanted to chime in, as I've been supporting these great co-chairs in assembling this group. And just as they've emphasized, our priority for this year was really bringing us together, getting to know each other, and really discussing what it is we want this group to do, what we want them to stand by, and how we want to work together. So that's something that I think we've been able to do well. And although we've had 40 organizations sign up to be part of this working group, that's our broader listserv. We do have about 10 to 15 very active organizations that are eager to support the activities that we have planned for 2025. So that's very exciting. The makeup of the organizations that are part of this working group vary. And I think that's wonderful in one way and challenging in another, because we have organizations from literally all over the world working on various different issues, as Amal and Rabia said, from whether it be HIV, working with migrant workers, working with non-communicable diseases, working with women and girls. So it's been really great this year to get to know each other and what the organizations do. And it's also been hard to really understand, across the board, how can we focus in on priority areas that impact all of our areas of work, and how can we think of activities that we can take to our countries or to our regions as well? How do we make all of the working groups activities relevant to everyone's own country context? That is definitely something that we're going to continue to work on in the next year. And again, excited to hear from you all, the audience, if you have any suggestions about that. On that topic, though, one of the really important purposes of this working group is to make a connection between what's happening at the global level with what's happening at the regions and in the countries. There's often a very big disconnect between that, and not enough civil society organizations in the regions and in the countries are participating in this global level work, which is a shame because they're on the front lines of all of the health challenges that we're facing. So it's really critical to have their representation, their inputs, and their support. And at the same time, it's really important for these organizations to be aware of what's happening at the global level, because it's also incumbent upon them to advocate to their governments as to what they should be negotiating at the global level, what their priorities should be at the global level. So making sure that these civil society organizations on the ground are informed is really important. And that's one of the great purposes that we hope this working group will serve over the next few years. I'm going to stop there, and if anybody has any questions or suggestions, we're a really small group, and I know some of you are GHC members that belong to some of our other working groups. So go ahead and raise your hand or unmute yourself if you have any comments, suggestions for us. I'll let you think about those, but I know many of you, and I know you're not shy, so please take some time to participate so we can get some of your great experiences and ideas. But before we do that, I'm gonna just stop sharing my screen briefly so we can start making this a little bit more conversational. I do want to point out that we have two other working group organizations that are working very diligently with us as working group members on all the activities that you've been seeing. We have Bilal Ahmed, and I'd love for Bilal to just come offline, if you don't mind, Bilal, and just briefly tell us a little bit about your organization and why you chose to be a part of this working group, and if there's anything else that you'd like to add that you've gotten out of the working group, or that you are looking forward to next year, please go ahead and share.
Thank you so much, Ariana, and thank you, Amal and Rabia, for a brief, overview of what we have done so far. So, am I audible?
Yes.
All right. So, I am Bilal from Pakistan. Basically, I represent Speak Trust, which is a non-for-profit organization working to address health inequities, and we are working with migrants, and we are also working for rare diseases patients, especially the children's. So I'm really honored to share my experience as part of this health equity working group, which is a coalition of civil society advocates from low and middle income countries working together to address these health inequities. I joined this group with a strong motive that to amplify the voices of vulnerable and marginalized communities, such as I mentioned, women, children, migrants, and displaced population, who often faces systematic barriers to access quality health care. So my journey with this group has been both inspiring and sort of action oriented, as together we have identified health equity priorities and contributed to the initiative like the WHO Global Program of Work and 77th World Health Assembly. We have done monthly, discussions, brainstorming, and webinars, which is kind of a wonderful learning experience for me as well. So these platforms have provided rich opportunities for, I mean, all of us to learn, share, and act. We have developed advocacy plans, including some key advocacy messages, as we discussed these earlier. So I'm sure there will be exciting and more engaging activities coming up in the next year or so. So my expectation from this group for next year would be of transforming our basic knowledge into some sort of concrete actions, and we hope that we will be able to integrate some new innovative methods for advocate effectively. So my suggestion list is quite lengthy, so I just picked some of them. So we should collectively advocate for sustainable funding to address health inequities, as you know that more funding would be required for institutional strengthening of CSOs and to build resilience of health infrastructure to respond to any sort of emergency, as calamity, as natural disaster or pandemics. So we should also, another suggestion that I was recently thinking of, that we should engage members from the vulnerable groups, vulnerable populations to whom we are advocating for, that these vulnerable groups, the member of these vulnerable groups should participate and lead the advocacy efforts. So I look forward to continuing this journey in 2025, focusing on the needs of vulnerable groups and ensuring that their voices are central to the health equity conversation. Thank you. Over to you, Eliana.
Thank you, Bilal. That was really great. I also wanted to introduce Lena Chauhan, and I hope I didn't butcher your last name, so feel free to reintroduce yourself if you'd like. Lena is also another one of our working group members, and Lena, I would love to hear from you as well, just about your organization, why you joined, what you're looking forward to, any suggestions you might have.
Thank you, Eliana, and you pronounced my name very well. Thank you.
Oh, perfect.
So, hello everyone. This is Lena Chauhan from Gravis, India. And Gravis works for, majorly in arid parts of India, and our major works area lies in the western parts of Rajasthan, which covers Thar Desert of India. So we are working with the desert communities here, and programmatically we are working on water security, agriculture and animal husbandry, health, education, community mobilization, and of course, research and advocacy. So, in a holistic manner, we are trying to improve livelihoods of communities living in these desert areas, especially in the rural parts of Western Rajasthan and parts of Uttarakhand and parts of Uttar Pradesh. So, yeah, being a member of this GHC Health Equity Working Group, I'm really honored to be here and to have an opportunity to speak in front of such a learned group and amplify voices from the community. I may sound similar to other working group member who will speak. I mean, who will get a chance to speak here. Because I think we all are here for same motive. We all are working in different parts of globe for achieving health equity in our in our region. So yes, it's a great platform to discuss what are the health priorities to achieve health equity at grassroots level, and what are the current health issues, who all are those who are lagging behind in getting these health facilities, health care. So yeah, I mean, we all are working for that, and Gravis is thankful to GHC. I mean, to letting us, provide this opportunity to speak up. I mean, the whole structure of this working group allow us to share, to learn, to share our experiences, to learn from other members, and yeah, and to provide our suggestions, to provide our inputs in advocacy messages that are spread across the globe. So yeah, that's from my side. Thank you.
Very helpful. So Bilal and Lena did such a great job giving you all an idea for the kinds of organizations that make up this group, why people have joined, and what people are expecting out of the group. So thank you very much. And we are so grateful to your participation, and we really look forward to continuing our work in the next year. I did put a few questions for the audience in the chat. For us, I think as a working group, we're really hoping to get suggestions from you all on any other key advocacy messages or even health equity priorities that you might suggest we tackle. Health equity is a very broad topic, so we want to hone in on those that are most key, but I want to make sure that we're not missing anything, particularly coming in the next year, that we should really be focusing on. And Orion, I see that you unmuted yourself. You're welcome to come in. We cannot hear you. Oh, I think that's they're reconnecting their audio. So we'll skip that. We might go back to you then if you can hear us once you have your audio on. Does anybody else have any suggestions for any key priorities? Like I said, health equity is very broad. So really, I think what I've heard with our working group and just in this presentation is a focus on people with lived experiences and that visibility, and bringing that visibility to the global health level, and talking about what those challenges and those needs are. Danielle, thanks for chiming in.
Thanks, Eliana, and thank you everyone for this presentation. This is such a great working group that you've set up, and I'm excited to see where it goes. I actually don't have any suggestions. I have two questions. One, I work for WaterAid, and we are a large INGO, but curious if my colleagues in some of our country programs are eligible to participate because they would be more affiliated with our country organization. So want to clarify that. And then my second question is, are there plans to perhaps partner or coordinate with some of the other groups that may also have a similar vision, I guess? I'm thinking of, for instance, of Women in Global Health, which was an organization that did start in the US, but has since branched out and has a number of chapters that are locally led around the world and are looking at some of these very same issues. And so curious if that's been given some thought, or even just putting it out there as a suggestion. Thanks.
Thank you, Danielle. And just to answer your question about GHC members who have representation in country, the answer is absolutely. So if you have any people that are sitting in the countries doing the country and the regional level work, they are more than welcome to join the session. If you want to put them in contact with me, I'm happy to give them the information so they can start joining our monthly meetings and get on our listserv. A lot of the organizations that have joined are really set on being very active and hands-on in our meetings. And I know many of you who are in our other working groups know that there are some organizations that are more active in the meetings and in many of our other activities. And there are some that are just on the listserv because they want to be informed and because they want to have knowledge about what's happening and get the news. And that's fine too. And that's okay. We did in our survey, our 6-month survey, get a sense for why or how people are using this working group. And there is a good amount of people that are really there just to stay informed. But certainly if you have suggestions for people that are excited to be, hands-on, even if they just want to stay informed, but certainly if they want to be part of the monthly meetings, everyone here, if you have suggestions for organizations, whether they're GHC members or not, that is one thing we forgot to mention, that this is right now open to non-GHC members. So if you know of any organizations, we're more than happy to include them, especially if they're keen to be a part of something like this. In terms of partnering with organizations like Women in Global Health, I think that's a really great idea. We could probably use a brainstorm within the working group to think of those kinds of groups that we might want to start talking to as a working group and seeing how we can partner with them on some of the activities that we're doing. I'm thinking about the webinars that we're hoping to do. And I know for our upcoming webinar that we want to do in the next year, which is a follow-up on our publication on health equity in conflict settings, we are planning on partnering with the International Federation of Red Cross and Red Crescent Societies, for example, and any other regional or country level organizations that are doing a lot in conflict settings. And we have organizations within our own working group that are working in conflict settings. So definitely we can start brainstorming and thinking about how we can do that. I'm happy to take one more question or comment, or I don't know, Amal, Rabia, Lena, and Bilal, if you have anything you want to add.
I just wanted to add maybe one thing is that this group has been like very beneficial for us personally, because we were able to, as I mentioned, voice our concerns when it comes to advocacy and health equity to the global scene, but also to contextualize what we have been discussing as a group back to our organizations and our countries. So there is that link between what is happening globally with what fits into the country level and the organization level. So yeah, I just wanted to point that out.
Any other comments or suggestions from the audience? Well, thank you so much, Danielle, for that. And I will say that, like Amal said, this is really an opportunity for us to engage people at the regional and country levels and inform them about what's happening at the global level. And as part of our 6-month survey, we did hear that people want more workshopping, more training opportunities to learn, how do we write an impactful statement for WHO or for the UN General Assembly, learning about these processes that are very complex, and even we at Global Health Council try to figure out every year, because some protocols are established and happen the same every year, like World Health Assembly, but internally and in the back end, there's a lot for us to learn about what actually happens during the negotiations, who's involved, how can we influence those processes. And so really being able to inform and give that information to these more local and regional level organizations, I think will be more beneficial, and hopefully we'll get more participation from them in these global level activities, which I think is very, very much needed. So I know that we're at time and we have a plenary panel coming up. I highly recommend everyone head over to the plenary panel. We have a wonderful group, but first I wanted to just thank Rabia and Amal, as well as Bilal and Lena, for being here today to talk about the Health Equity Working Group. Amal and Rabia have been amazing colleagues. I've learned a lot from them too, and I look forward to continuing our work with this wonderful group of organizations. So thank you, and hope to see you in the next session, everyone.
Thank
Bye.
you. Bye.